Cap Echo, focusing on adolescent military mental health for primary care. I'm Sean Pustilnik, a child and adolescent psychiatrist at Georgetown University. And today we're going to be talking about adolescent well-being interventions for mental health within primary care. Our objectives for today will be to define well-being and appreciate how this relates to mental illness. And we'll discuss the role of well-being interventions that you can do within primary care, and specifically how you can apply this to the military child or adolescent. So just to start out with a case example, you're seeing a 16-year-old boy C with a remote history of ADHD, but who hasn't taken any medicine stimulants since middle school. He returns to you now for the third time recently with complaints of anxiety and panic symptoms in the context of beginning to apply to colleges. Air Force Academy and Navy are his top choices. His scared score, that's an anxiety measure from last visit, shows a 27, which is in the at-risk range for anxiety. He has not followed up on your recommendation to engage with CBT psychotherapy. And his mom specifically asked you during the visit if he could have his diagnosis of ADHD be removed from his chart, because she believes that's going to be a barrier to his dream of becoming a fighter pilot. What can you do? So just thinking for a moment about this case, you could spend your 10 or 15 minutes in your office visit, recounseling him, thinking about a medicine, re-referring him to psychotherapy, but it may not be likely that he's willing to accept that medical explanation for his symptoms, and you may feel stuck or like you don't have anything that you can do to help this patient. Just to define well-being, well-being is the dictionary definition is a state of being happy, healthy, or prosperous. This can include several domains, including physical, emotional, social, intellectual, or spiritual. And when we talk about well-being in terms of emotional or mental health, we often refer to positive psychosocial characteristics like resilience, coping and self-efficacy, social engagement, and optimism. And one thing that it took me a really long time to figure out as a psychiatrist and as a physician is that well-being is not simply the opposite of illness, but it is a different category. It's kind of got its own domain. And so a different way visually to think about well-being is that you can have, in terms of illness, you can have high symptoms of illness or low symptoms of illness, and at the same time either have high well-being or low well-being. So you just to give some examples from the physical realm, you have seen kids probably with really severe medical problems like cancer or diabetes, asthma, epilepsy, irritable bowel disease, who have high symptoms of illness, but may flourish and or struggle through that, and still lead lives that are very fulfilling, get to school, have relationships. Like these are like the Make-A-Wish kids that everybody rallies behind. And at the same time, you can have those kids who get a concussion or stub their toe, and then they can't go to school for 6 months. And so the relationship between illness symptoms and how well they're doing isn't necessarily linear. And as we think about mental health, you can have the same kind of picture where you can have high symptoms of anxiety, depression, ADHD, or even severe mental illness symptoms like psychosis, and engage in behaviors that make you feel really well, or let those kind of control your life and withdraw from all sorts of activities. And as we think about things that teenagers, adolescents, and young adults are typically supposed to be doing, what does a typical teen do that lets you know that they're well? And so oftentimes these are social relationships, friendships, romantic relationships, being engaged in school, in family, and doing behaviors like getting a good night's sleep, eating well, participating in mindfulness, or other sort of physical activities, sports, music, something creative. As we've seen over the last few years, factors like COVID-19 can prevent you from just being able to access activities. So when all the gyms closed or when all the schools closed, we had kids who did not have access to their school or social outlets or physical activities, and that had a big impact on their well-being. It wasn't that all of a sudden all kids became anxious and depressed. They were not able to engage in those behaviors that they're supposed to be doing. And so in the same way, what we know, and I'll show you in the next few slides, is that things like screen time can decrease the opportunities for all of those things using substances. And specifically to the military, when a family PCSs or deploys, that can decrease the opportunities for these positive well-being experiences. Just to show it in some pictures, for one example, this is some data collected from the National Survey of Children's Health, and this will focus on screen time. So what we know, and this is about 8 years old now, but the relationship between the age of the child and the number of hours that they spend on screens goes up over time. So as kids get into teenage years, their total hour of screen time on average is around 4 or 5 hours a day. And that is with TV and video games being mostly flat, a lot of that is being occupied by phones or computers. And when we look at that behavior and the impact on mental health, there is something protective because they're kids that spend no hours per day on screens actually have a little bit higher rates of anxiety and depression. And so after about an hour or two, which seems to be somewhat protective, any screen use beyond that tends to exacerbate or accelerate anxiety and depression conditions. And also in the same pattern, kids who are being treated for mental health problems or receive psychiatric medications, after about an hour or two a day, we see a big increase over time per day of using screens. So there is this relationship between withdrawing screen use and withdrawing from those well-being activities and impacts on mental health. And then to see it in other pictures, this is from an Atlantic article a few years ago, but just noting in 2007 when the iPhone was released, teenagers in general stopped hanging out with friends as much. They stopped getting their driver's license, dated less, which means less sex, which some parents are happy about, but they're more likely to feel lonely and less likely to get enough sleep. So all of those things that teenagers are supposed to be doing have really taken a hit. One thing that you can do in your office is a well-being inventory. This is adapted from something that the University of Vermont Family-Based Clinic does. This is a well-being inventory that you could use in your office if you detect a problem with mental health or emotional health, or if you had that patient that I referred to come in the beginning. You could give them this sheet and have them fill it out, go see the next patient and come back. But this focuses on several different domains of wellness pillars in different categories. And it asks, what are you already doing and how are you doing? And you'll see in a second that it actually is nice because it can highlight what are some things that the child is already doing well. And then what is their priority for change? Is it low, medium, or high? And then this can help you come up with goals together. So if you gave this to the patient and came back, you say, okay, this child is playing soccer 2 times a week, which they feel like is adequate. They feel like maybe I should change that. And they come up with a goal of adding a day or 2 of physical activity. They're already playing guitar 4 times a week, which they're doing an exemplary job and they don't feel like they need to change. But you can look at all of the different domains and say, okay, this one's deficient. What's that? Screen time. Okay, 4.5 hours a day, that's pretty high. And their priority is to change it. So they're going to delete TikTok from their phone and try to get it down to 3 hours a day so they can get another hour of sleep or engage in another hour of physical activity. So don't underestimate the power of your prescription, and you can prescribe some of these well-being interventions, even just getting out the old paper prescription pad that you might have tucked away in a drawer somewhere, or entering this as a non-formulary prescription on an EMR and printing it out for the family. There is some power in prescribing specific interventions, and you might not necessarily do all, 5 or 6 things in one visit, but say, okay, we've talked about that the screen time is really a big barrier to you feeling well right now. Let's delete TikTok and let's try to exercise or engage in some physical activity 5 days this week, or have a family meal together, or do something fun each day for 30 minutes. And you can take a motivational interviewing approach with this. I won't go through all of these examples, but if one strategy is that you say, how important do you think that it is to your health that you exercise more this week on a scale from 1 to 10? Okay, what makes that a 7 and not a 1 or 2? You're asking about what are the reasons that they think this is important. And then what makes it a 7 and not a 9 or a 10? Identifying some of the barriers. How likely do you think that you are to change your behavior? 1 to 10. And this type of motivational interviewing approach with any of these behaviors, be it physical activity, exercise, nutrition, mindfulness, family meal, this type of approach can help the patient advance and be more likely that they're going to engage in those behaviors. And if there's any mental health professionals watching this, this is something that you might bill as psychotherapy time as well. And then when you're following up with the patient, you can have them create a log of, just Monday through Sunday. What are the activities that you found were important? And then what was your goal and how successful were you at doing that? And you can get a snapshot of, okay, you did a really good job with that deep breathing practice. Or, oh, it looks like you had some trouble sleeping on Thursday. What are some of the things that you think you were able to be successful with, and what are some of the things that we could do to make that more successful? Or are there any other interventions that you feel like you want to add to this list at this time? And that's it. Here are some of my references. Thank you for joining.